Welcome back. We're going to continue on and discuss youth suicide. Suicide itself is not a mental disorder, but one of the most important causes of suicide is mental illness. Most often, depression, bipolar disorder, manic depressive depression, schizophrenia, and substance use disorder. The great majority of people who experience a mental illness do not die by suicide. However, of those who die from suicide, more than 90% have a diagnosable mental disorder. People who die by suicide are frequently experiencing undiagnosed, undertreated, or untreated depression. An estimated 2 to 15% of persons who have been diagnosed with major depression die by suicide. Suicide risk is highest in depressed individuals who feel hopeless about the future, those who have just been discharged from the hospital, those who have a family history of suicide, and those who have made a suicide attempt in the past. An estimated 3 to 20% of persons who have been diagnosed with bipolar disorder die by suicide. An estimated 6 to 15% of persons diagnosed with schizophrenia die by suicide. Suicide is the leading cause of premature death in those diagnosed with schizophrenia. Between 75 and 95% of these individuals are male. Also at risk are individuals who suffer from depression at the same time as another mental illness. This is called co-occurring disorders, specifically the presence of substance abuse, anxiety disorders, schizophrenia, and bipolar disorder put those with depression at greater risk for suicide. People with personality disorders are approximately 3 times as likely to die by suicide than those without. Persistent harm is different than suicide attempts and require different approaches. Suicide attempts are designed to kill oneself. Self-harm is not designed to kill oneself. Self-harming is contagious and is driven by social environment. Remember, we are not tasked with diagnosing youth. We can appropriately refer youth to school nurses, school counselors, or youth-based therapists. These professionals may make referrals or provide screenings and next steps. Risk factors for suicide are not definite ways to identify youth who will attempt death by suicide. In fact, we very few robust predictors of who will die by suicide. A risk factor is defined as some variable that increases the likelihood of an event occurring. A risk factor does not necessarily cause the event. Rather, the presence of the risk factor makes the event more likely than it would be if the risk factor was absent. Strong risk factors for suicide are presence of current suicidal plan, previous suicide attempt, history of mental disorder including substance abuse, especially bipolar and depression, availability of lethal means, access to methods, history of childhood sexual or physical assault, family history of completed suicide, family history of psychiatric illness. That being said, a strong predictor of suicide is having a previous suicide attempt with hospitalization. A serious red flag for suicide among boys is having a previous suicide attempt. Teens are impulsive. Early and effective treatment and response are essential. Suicide is an emotional issue. Emotionally driven decisions are often not best decisions, essentially to do the right thing, not just something. Evidence shows that most effective approach to suicide prevention is identification, diagnosis, and effective treatment of mental disorders. Gatekeeper programs in controlled settings or institutions have a good promise for positive impacts, not community education campaigns. Some interventions have not been demonstrated to substantially decrease suicide rates. Signaling is the part of the brain system. What we have on this slide is a visual representation of a sympathetic nervous system cascade. It's instant. 1, danger happens. 2, we sense the danger. 3, brain registers danger. 4, our body initiates the cascade of signals and circuits to make us respond instantly for survival. 5, we go into a fight, flight, freeze response. When you're in danger, your body's natural reaction is to rapidly initiate the fight or flight response. This brain response occurs immediately when someone senses danger, and it activates many brain areas that are designed to protect you from that danger by preparing you to fight the danger or escape from it. As part of this response, the brain triggers the release of adrenaline and other hormones throughout your body so you can respond to the threat. This protective mechanism is called the fight or flight response, and it helps us to survive. Your emotional and physical responses during fight or flight can be described as panic to fight or flight. Anxiety. We often use these words interchangeably, which is not very helpful and can cause confusion. We can just lump them under the category of stress without noting whether the condition is acute or chronic. The impact is different, or whether the condition is positive, tolerable, or toxic. We also often use the word anxiety to mean a stress response created by something in the environment that is not likely to be harmful. We can differentiate this concept of anxiety as healthy and resilience building, or as negative and resilience impeding. This depends on how we think about and act in response to the anxiety or stress response signal. Anxiety disorders are persistent, excessive, inappropriate, causes impairment, and leads to dysfunctional coping such as withdrawal and avoidance. Typical stress response: physical symptoms, insomnia, palpitations, increased heart rate, suffocation, dizziness, shaking or tremors, shortness of breath, stomach upset, restlessness, diarrhea, change in appetite, flushing, blushing, sweating, faintness, chest pain. Thinking, cognitive symptoms, worry, apprehension, difficulty making decisions, poor concentration, repeatedly thinking the same distressing thoughts, example, obsessions and ruminations. Catastrophic thinking, increased or decreased awareness of one's surroundings, confusion. Behavioral symptoms, aggression, avoidance, agitation, restlessness, substance use, alcohol, benzodiazepines, sleep medicines, social withdrawal, repeated behaviors. Anxiety is a state of constant hyperarousal. While the same stress response symptoms may be the same, the critical difference is the action of withdrawal and avoidance of the stimuli. The bottom left-hand side of the curve represents an individual who doesn't have enough arousal to perform well, a baseball player who is sleepy when he or she gets up to bat. The bottom right-hand side of the curve represents an individual who is over-aroused. The baseball player is too nervous to grip the bat, and he or she is shaking and worried about losing the game. Individuals need to have an optimum level of arousal in order to improve our performance on a task. Too much arousal and we are paralyzed. Too little and we're unmotivated. But just the right amount of arousal keeps us alert and focused, so we perform to the best of our abilities. Everyone has their own optimum level, and it takes experimenting and experience to find it. Anxiety grows each time we avoid a stimuli in the period of habitation. Example, avoiding the activity in order to diminish the physiological responses or the feelings and emotions that arise becomes longer. If an individual can complete a task that makes the feelings, the physiological symptoms emerge, then the anxiety will diminish. This is the same slide showing a more rapid onset, such as being called on in class. It shows a higher level of anxiety than a longer time frame to recover. Three things to do. Useful approaches are to identify the thinking distortions involved in the escalation of the arousal or anxiety, and work to correct the stuck thinking. This can be done through cognitive behavior therapy or cognitive attribution. Number 2, consider how to solve the problem. This may involve consulting with others. 3, modulate the apex of the stress response using the effective breathing, breath holding, and centering. You can use progressive muscle relaxation techniques and mindfulness practices as well. Types of stress. It's important not to confuse the different levels of stress. There's toxic stress, which is prolonged, extreme, physical and sexual abuse, chronic neglect and violence, mental illness, substance abuse, without adequate adult support, occurs acutely or chronically. Tolerable stress, it's a serious impact, can be temporary, buffered by supportive relationships, occurs across a lifetime. And positive stress, relatively brief, leads to adaptation and learning, does include negative emotional, physical, behavioral, and cognitive states, and it occurs daily. Useful and not useful approaches to stress response and signal management. So identify and correct the thought distortions. Consider how to solve the problem. Modulate the apex of the stress response. Use simple and effective breath holding and centering, progressive muscle relaxation techniques. Understand the stress response, its purpose, and its various levels. Interpret the stress response as positive, not negative, a challenge to be faced, a problem to be solved. Don't turn in and isolate. Don't focus on modulation of the stress response while ignoring the other approaches, and don't avoid. Examination anxiety and why it's the wrong name. More and more students are requesting accommodations for anxiety. Schools are constantly requesting strategies to address test anxiety. A key point is, test anxiety is what motivates an individual to do well. To be optimally stimulated to perform well, worry arousal must be present. If students are reporting anxiety during a test taking, it does not mean that they have a disorder. If you have two groups where one is rewarded for outcome, getting the right answer, and the other group you reward for hard work, eventually group 2 will outperform 1. Dealing with exam stress response. Accommodations are fine so long as they don't allow the student to avoid or withdraw from the stimulus or event that they are anxious about. Good accommodations for anxiety are progressive. You are working to gradually expose the youth to the stimulus so that you systematically desensitize them over time. Ideally, students write an exam in the same classroom as they learn the material. This is better for recall. Avoid having students wait around together or flocking to share contagious, anxious worries. Example, did you study the chart on page 34? This is going to be on the test. Oh no! Mental disorder of signaling, the anxiety disorders. What is anxiety? Anxiety is a term which describes a normal feeling people experience when faced with threat or danger, or when stressed. When people become anxious, they typically feel upset, uncomfortable, and tense, and may experience many physical symptoms such as stomach upset, shaking, headaches, etc. Feelings of anxiety are caused by experiences of life, such as a new relationship, a new job or school, illness, accident, etc. Feeling anxious is appropriate in these situations, and usually we feel anxious for only a limited time. These feelings are not regarded as clinical anxiety, but are part of everyday life. What are anxiety disorders? The anxiety disorders are a group of illnesses characterized by persistent feelings of intense anxiety. They are feelings of continual or extreme discomfort and tension, and may include panic attacks. People are likely to be diagnosed with an anxiety disorder when their level of anxiety and feelings of panic are so extreme that they significantly interfere with daily life and stop them from doing what they want to do. This is what characterizes an anxiety disorder as more than a normal feelings of anxiety. Anxiety disorders affect the way the person thinks, feels, and behaves, and if not treated, causes considerable suffering and distress. They often begin in adolescence or early adulthood and may sometimes be triggered by significant stress. Anxiety disorders are common and may affect 1 in 20 people at any given time. All anxiety disorders are characterized by heightened anxiety or panic, as well as significant problems in everyday life. Generalized anxiety disorder. Generalized anxiety disorder, or GAD, is a disruption in how your brain controls the signals it uses to identify danger and initiate action to help you avoid it. However, in GAD, this signaling mechanism does not work as it should, and you experience the danger signal when there is no danger. GAD is excessive anxiety and worry about everyday events that occurs over a prolonged period of time. Someone with GAD worries excessively about many different things and is not able to control his or her worry. They are masterful worriers. The worrying and anxiety causes serious emotional distress and causes problems at school, at work, and in relationships. These feelings of anxiety usually have a physical component, including headaches, aches and pains, nausea, shaking, and sweating. Feeling anxious in response to danger or in a new situation is a perfectly normal response. It's called the fight or flight response and helps us survive in dangerous situations. But these typical feelings are different from GAD. A person with GAD constantly feels tense and on edge, even when there is no danger present. Social anxiety disorder. Social anxiety disorder is when certain social or performance situations, example, meeting new people or giving a speech, are avoided due to substantial fear of being judged or embarrassed in front of other people. When exposed to social situations, someone with a social anxiety disorder is so afraid of being negatively evaluated or judged that it significantly interferes with his or her ability to live a normal life. This can cause him or her to avoid everyday social situations like going shopping, speaking up in class, using a public bathroom, or participating in gym class. It is perfectly acceptable to be anxious occasionally during social situations. This type of anxiety often helps us prepare for that situation. For example, practicing a speech before giving it in class, making sure you have enough money before going out on a date, etc. However, usually expected and normal social situations almost always provoke fear or anxiety in individuals with social anxiety disorder. This fear or anxiety is way out of proportion to the situation. Someone with social anxiety disorder often knows that his or her fears are unreasonable and that other people don't feel the same way. This can make him or her feel really alone and think that no one else can understand how he or she feels, which can lead to feelings of loneliness or sadness. For 75% of people with social anxiety disorder, it began when they were between 8 and 15 years old. Social anxiety disorder is thought to be caused by a combination of genetics and environment and learning. Panic attacks. Sometimes panic can occur out of the blue when you're not in any danger. These panic episodes are called panic attacks because you're not in any danger. These panic attacks aren't useful, and in fact, they can cause significant problems. If someone experiences many panic attacks, he or she often begins to worry about having another panic attack, and the anticipation causes him or her to feel even more anxiety. Sometimes this worry becomes so strong that he or she will avoid going to places where a panic attack might happen. For some people, this may severely limit where they feel comfortable going, such as school, the mall, driving on the highway, etc., resulting in another mental disorder called agoraphobia. Panic attacks can be normal. They happen. It doesn't always indicate a mental illness. Chronic panic attacks are not normal. Panic disorder. Panic disorder occurs when people suffer from sudden, unexpected, uncomfortable panic attacks. These panic attacks aren't caused by any obvious fear. Example, having a panic attack because you're afraid of heights and on top of a ladder, or if you're afraid of flying and about to board a plane. People with panic disorder experience anticipatory anxiety, worrying about having another attack or the consequences of having another attack, and avoid going to places where a panic attack may happen. Not all people who have panic attacks have panic disorder. Panic attacks can occur in many different anxiety disorders and also in people who don't have an anxiety disorder at all. In panic disorder, the panic attacks occur without any obvious reason. In other anxiety disorders, example, social anxiety disorder, the panic attacks are triggered only by feared situation or thoughts. Example, being in social situations. In any 1 year period, about 2 to 3% of people will have a panic disorder. Although anyone can develop panic disorder, rates are higher among family members with panic disorder and other anxiety disorders. Panic attacks may begin in childhood or early teen years, although panic disorder usually begins in late adolescence or early childhood. Anxiety disorders can often lead to secondary issues. Example, a person with a social anxiety can start to drink before they go to a party to calm themselves. The drinking, in turn, becomes problematic. What to know about treatment? Treatment takes longer for teens and adolescents, 8 to 10 weeks. Adults often respond more quickly. Align school accommodations with treatment and interventions. Help youth get through and over anxiety via supports and not reinforcement of avoidance. It's critical to work with providers on supporting students. Persistent self-harm. When someone self-injures, they do not intend to die. Young people who self-injure may do so as a method to cope with stress. Hurting themselves is often seen as a way to control their upsetting feelings. Others do so to dissociate from their problems, example, to distract themselves from emotional pain. Research suggests that self-injury can activate different chemicals in the brain, which relieve emotional turmoil for a short period of time. Self-harming teens need assistance to learn more effective ways to solve life problems. Connecting with them with professional assistance is recommended. So behavior that can occur by itself or in the context of another mental disorder and has numerous complex causes, often secretive or shared in the subgroups, has complex causes, is helpful to reframe as an unhelpful method to address ongoing problems. Get specialty mental health team assistance. Can be an attempt to seek professional assistance in a difficult life situation and requires complex treatment and strategies. And lastly, do not agree to keep it a secret. This concludes part 3. Please join me for part 4 and our conclusion, part 5. Thank you.